Let's begin by demystifying some of the most common myths and facts about blood pressure. Knowing the facts can help you make smarter choices. In fact, one of the best things about educating yourself is that you'll get all the knowledge you need, which can give you the power to take your health in your own hands. Myth number 1. High blood pressure runs in my family, so there is nothing I can do about it. It's a myth. The fact is that you can't put all the blame only on your genes. Agreed that high blood pressure can run in families. So if your parents have had high blood pressure, you are more likely to develop it too. But the fact is that genes only load the gun. It's the diet and lifestyle that pull the trigger. Just like your genetics, your dietary habits and your lifestyle can also run in the family. It's true that you can't change your genes, but you can certainly make healthy dietary and lifestyle choices. You see, if you continue to follow the same diet and the same lifestyle that your parents followed and they had all those chronic health issues, then you are more likely to develop all those health issues as well. So get into the driver's seat and take your health in your own hands. Lifestyle choices have allowed many people with family history of blood pressure to avoid developing hypertension to a great extent. Following a healthy diet, maintaining a healthy weight, and regular exercise can have a huge impact on reducing your blood pressure. Weight loss itself can have a huge impact on your blood pressure. Exercising for just 30 minutes every day can reduce your blood pressure to a great extent. Also, managing your stress and ensuring that you get adequate sleep can help keep your blood pressure in check. Myth number 2. I don't have any symptoms of high blood pressure. I feel fine. So why should I worry about high blood pressure? Well, this is a myth. The fact is, unless your blood pressure is dangerously high, you will not have any symptoms. But the long-term damage high blood pressure has on your arteries occurs regardless of whether you have symptoms or not. About 103 million US adults have high blood pressure and many of them don't even know it. High blood pressure is a major risk factor for heart attack and stroke. Uncontrolled high blood pressure can lead to serious and severe health problems. You may not be aware of that. It's damaging your arteries, heart, and other organs. So know your numbers, get yourself checked regularly, and don't make the mistake of assuming any symptoms will let you know that there is a problem. Myth number 3. High blood pressure is when the numbers are over 140/90. The fact is that high blood pressure used to be defined as over 140/90, but that definition has changed in the past few years. Today, if someone has blood pressure over 130/80 and has a history of cardiovascular disease, or if they are at a higher risk of having a cardiovascular event, their physician may raise a red flag. The top and the bottom number both matter. If either of them is high, then you have hypertension and your risk of a heart attack or stroke is increased. Myth number 4. I know I have hypertension and I get my blood pressure checked at the doctor's office every month. I don't need to worry about checking it every day at home. The fact is that the best investment you can do for your heart health is to buy an easy-to-use blood pressure machine for your home. Because blood pressure can fluctuate, home monitoring and recording of your blood pressure readings can provide your doctor with valuable information to determine whether you really have high blood pressure, and if you do, whether your treatment plan is working. It's important to take the readings at the same time each day, such as morning and evening, or as your doctor recommends. Myth number 5. My blood pressure is in the normal range today, so I don't need to take my blood pressure lowering medication today. The fact is that you should never play with your medications and never stop your medications suddenly. Continue taking it unless your family physician gives you a green signal that you can safely get rid of your blood pressure medications. You see, medications do not cure hypertension. So if you stop taking your medications, then your blood pressure can rise again. If you have any questions or concerns about your medicines or treatment plan for high blood pressure, talk to your doctor. Follow your healthcare professional's recommendations carefully. By partnering with your healthcare team, you can successfully reach your treatment goals and enjoy the benefits of better health. Myth number 6. I don't need to worry about blood pressure. I'm young. Well, the fact is that it's true that high blood pressure is more common among older people, but young people can have it too. This is because our arteries naturally stiffen as we age, and that increases the resistance within our arteries, which increases the blood pressure as we age. But we are seeing a rise in children and teens developing blood pressure issues, possibly because of an increase in childhood obesity, unhealthy eating habits, and unhealthy lifestyle. Just like high blood pressure in adults, there are often no symptoms, and early diagnosis and treatment is absolutely crucial. Treatment of high blood pressure in children centers on management through a combination of lifestyle factors like diet, weight management, and exercise, and medications if required. Myth number 7. High blood pressure is more common in men. The fact is that it depends on age. Before the age of 50, hypertension is more common in men than women, but after menopause, a woman's risk increases and can even be higher. Women have a few additional considerations for high blood pressure. Taking birth control pills may raise their risk of hypertension. Women with high blood pressure may have a greater risk of complications during pregnancy, and women who develop high blood pressure during pregnancy are more at risk of having high blood pressure later in life as well. Myth number 8. If I am on blood pressure medications, I don't really have to be too worried about exercise or watch what I eat. The fact is that you still need to continue a healthy lifestyle. There is absolutely no substitute for a heart-healthy diet and exercise. In fact, it is the most important measure you can take to reduce your risk of heart attack or stroke. You see, when your doctor starts you on blood pressure medication, it is only because they believe that lifestyle measures are not enough to lower your blood pressure to normal at this moment. Myth number 9. I don't use table salt anymore, so I am in control of my sodium intake and my blood pressure. Well, the fact is that in some people, sodium can increase blood pressure, but controlling sodium means more than just cutting down your table salt. It also means checking all the labels, because up to 75% of the sodium we consume is hidden in processed foods like tomato sauce, soups, condiments, canned foods, and prepared mixes. You see, when buying prepared and pre-packaged foods, read the label. Watch for the words sodium or the symbol Na on the label. These words show that sodium compounds are present. Myth number 10. People say that wine is good for your heart, which means I can drink as much as I want. The fact is that drinking too much alcohol can raise your blood pressure. If you have been diagnosed with high blood pressure, your doctor may advise you to reduce the amount of alcohol you drink. If you drink alcohol including red wine, do so in moderation, because heavy and regular use of alcohol can increase your blood pressure dramatically. It can also cause heart failure, it could lead to stroke, and it could produce irregular heartbeats. Too much alcohol can contribute to high triglycerides, abdominal obesity, and even cancers. If you drink, please limit consumption to no more than 1 drink per day. Myth number 11. Fat clogs the arteries and lead to atherosclerosis and cardiovascular disease. But I don't see any connection between sugar and heart disease. The fact is, sugar is the real culprit behind atherosclerosis and cardiovascular disease. Healthy fats in moderation are still fine, but sugar and refined carbs lead to metabolic syndrome, which could be one of the major contributors to heart disease. Myth number 12. It's okay to use sea salt instead of regular table salt if you have hypertension. Well, the fact is that chemically, the sodium content of sea salt is the same as table salt. They both have 40% sodium, and they both count the same towards your total sodium consumption. Experts recommend limiting salt of any kind in your diet if you have hypertension. Sodium can increase your blood pressure because it holds on to excess fluid in your body. Even small reduction in the sodium in your diet can improve your blood pressure to a great extent.